guys, day 2 of the Fall Clinical Excellence Series here with Dr. John Cranham. Man, it's been a pleasure having you.
I had a ball, man. The group is amazing, and I think the level of your dentist is impressive. So
Yeah.
congratulations.
Well, thank you. I know we had a great morning and a really good response, so we're getting ready to kick off the afternoon, but I wanted to ask you a few questions.
Sure.
Obviously, you've been with the Dawson Academy for a while, and you serve as their clinical director. Tell everybody a little bit about what that entails and what your role is there.
Sure. So I think mainly, my role is focusing on the curriculum.
Okay.
As a practicing dentist who is seeing patients and also doing education, I think I've got a pretty unique understanding of what the challenges are today with practicing dentists. So I work with the faculty in terms of helping select who's going to be where, getting all the right people in the right seats on the bus, if you will.
Yeah.
And then working directly with Dr. Dawson to make sure that the curriculum is organized in a way that it's understandable, but maybe most important, can be implemented when they get back to practice.
Yeah.
So, so it's a lot of fun, kind of being that liaison between Pete and the rest of the faculty.
Yeah, I'll bet. And, I know, especially the last few years, there's been a lot of talk of the recession and coming out of it. Now that we're getting on kind of somewhat of the other side, what are some of the changes you've seen? Maybe even some of the positive of where you see dentistry going after that kind of downturn?
It's interesting. I think 4 or 5 years ago, there was sort of this, I think, artificial bubble in terms of the interest in cosmetic dentistry, and I saw patients that didn't even really value their teeth, spending thousands of dollars on cosmetically driven things. And it's not that these principles aren't important, but I think we've come back to a little bit more of a simpler time where we're really healthcare professionals first, and that we're there not only to make the dentistry last long and functional, but also to make it look as good as we possibly can.
Yeah.
I think the other thing that has been positive is we still have the same responsibility to treatment plan optimally, but there's a much greater need today to sequence dentistry. So we can take these plans and break them up into segments that patients can afford and work on maybe a 3 or 4 or 5 year program. And I think that's hugely positive. As I mentioned this morning, I think that before that, there were so many people doing it that there were a lot of dentists that treated, a lot of patients that maybe didn't get the dentistry they could have had just because we didn't have the desire or even knew how to sequence optimally. And that's really, if you look at one of the differences at the Academy, that's something we spent a lot of time on. Treatment planning optimally and train our docs to segment complex treatment plans in a way that people can do it over time.
Yeah. Well, and I would even say most importantly, keeping them in the practice.
Absolutely.
Through that time.
Absolutely, because even patients that can't do it right now, a mother with 3 kids in college, sometimes the best thing we can do for them is, make them a really good splint, keep the perio healthy, get rid of the biological issue, and put that patient in a holding pattern until their financial situation changes. And what I find is that the more patients you have that in your practice, it's like an annuity. They just kind of show up at the right time. So I think you have to be understanding that this process is about doing, teaching docs to be predictable with cosmetic cases and implant cases and bigger cases, but ultimately we are healthcare providers, and we have these general practices, and we have hygiene checks and fillings we got to do, and how do you do the mix of it successfully and keep the stress down and the profitability up? And that's what we teach people how to do.
Yeah, good. Well, I know, and just lastly, we just confirmed with your office our event for next year, so we're going to look at October 11th, or 11th and 12th of 2012. So you're going to be the speaker again on Thursday, but kind of a different direction or a continuation of this.
Yeah, a continuation of this, and maybe a little bit more focused on some of the managerial and marketing things that we do to try to build your name in your community. We want our doctors to be the go-to practices in their area. And, as you know, and I'll tell you guys, the technical aspect of it is one thing. And we can show maybe a little bit more of the spin of some of the things that we do. I know enough about your organization that there's a lot of synergy and commonalities with what we do. But I think a lot of times, where doctors struggle, even if they get the technical excellence absolutely down, it's getting the team aboard and implementing it and all the systems that they need to have on these more complicated cases. And so we'll get into that, and we'll have a nice balance between the technical as well as the practice management side.
Yeah.
And then, we'll see what we can do. We'll talk to Dr. Dawson. He'll be there in St. Pete, and hopefully his health will be good, and we can get him over for lunch on that Friday for a little round table.
Yeah. Well, we're looking forward to it, guys. And that meeting's going to be in St. Petersburg, Florida. Some more details to come. But hey, thank you so much for your time.
My pleasure.
It's been a pleasure. You've had a great event.